Good afternoon. I think it's afternoon everywhere across this country now. Pleased to join this conference today, and very thrilled to have Joseph, Fanny, and Mark joining me today. My name is Karen McClure. I'm the Chief Investment Officer of Canada's Digital Technology Supercluster, and have the honor and privilege of working with companies like DNA Stack and Roche and Nerve to leverage data and develop fantastic digital technologies to improve access to healthcare, health outcomes, and the sustainability of our healthcare system. Before we get started, Yusuf, why don't you introduce yourself to the audience?
Yeah, of course. Yusuf here, CEO and co-founder of Nerve. And at Nerve, we've built a continuous monitoring solution that monitors patient recovery in real time in order to identify potential post-operative complications as soon as they develop, so that we're able to take different forms of early intervention and act upon warning signs early. Our solution is hybrid between hardware, software, and data, all combined together to provide a seamless service and a disruptive operative care.
Thank you so much. Fanny.
Thanks, Karen.
Hi, everybody. My name is Fanny C., and I'm the head of Artificial Intelligence and Digital Health at Roche Canada, Pharma International Informatics. And I'm really excited to be part of this panel because as I look into the panel themselves, like phenomenal experts and innovators in their class, and they're Canadian, which is fantastic. And it just goes to show what can be enabled in this country. And I'm very proud to be a representative of somebody who is data-driven, as well as an organization that is data-driven, to help not only get solutions faster to patients, but also to bring those stakeholders together so that we can do better for more people faster. So thanks for having us, and I'll pass it back to Karen.
And Mark, not last but not least in the introductions.
Thank you, Karen, and Fanny, you're too kind. My name is Mark Fume. I'm the CEO at DNA Stack. We're a Toronto-based software company. Our mission is to accelerate breakthrough discoveries in genomics and precision medicine by creating federated data hubs of genomics and health data. And I'm really excited about our conversation today. I think it's super timely and important. So thank you for the opportunity.
That's fantastic. So first of all, I wanted to thank the University of Waterloo and CIGI for inviting us today. I'm super excited about the work that the Pan-Canadian Health Data Strategy Expert Panel is doing, and I'm looking forward to seeing their final report, their third report coming out very soon. Today we've heard a lot about challenges and opportunities, and I want to move beyond, what's possible in the future to what's really happening today on the ground. So despite some of the challenges that face us in terms of data sharing and access to data and all of those things, in spite of that, we've got a lot of very smart people, very persistent people who are determined to solve some of these problems in spite of those challenges. So we're going to talk about some of the opportunities and some of the real things that are happening on the ground. So first of all, maybe Yusuf, I'd ask you to share some of the things that you've seen and learned over the past few years as you've been developing your solutions, and some of the barriers that you've knocked down as you've implemented.
Absolutely. So, I'll start by perhaps introducing the problem statement at a high level. Ultimately, our core fundamental focus is on the post-operative recovery period. So you have patients going through surgery, and then unfortunately, a subset of these patients end up developing different forms of complications just because of the risk associated with different surgeries. And ultimately, we've lived this with hospitals and surgeons over many years. You'll find that the typical approach when it comes to post-operative care revolves around symptomology and essentially waiting for patients to present different forms of symptoms for us to take action. And this ultimately became the problem opportunity where Nerve decided to tackle and build a solution platform to address the problem. And fundamentally, just waiting to react based on patients developing different forms of symptoms is in itself a broken system. I mean, you wouldn't accept this for anything. Like if the primary indication that your car is not working is for your engine to be on fire, I'm sure a lot of people would be worried driving down the road. And you'll find that healthcare has adopted this for many, many years. And the amount of data that's available associated with post-operative patient recovery is tremendous. And if we could capitalize on this data in a way to help every single individual patient at an individual level, which for us revolved around creating a risk factor analysis for different patients, then we're able to essentially discharge healthy patients early and give them the best care possible. And for patients who need help, we're able to administer help early. Our solution has been augmented with our monitoring platform. So there's a hardware component to it that synergizes with the existing data to build on the data set and ultimately deliver the best care possible. But that's the position that we took at Nerve, and that's where our solution is. And I mean, it's deployed across a number of Canadian hospitals, including UFT's Unity Health, McMaster University, and internationally as well in sites such as Cleveland Clinic.
Oh, fantastic. Thank you for sharing that, Yusuf. Fanny, you know, over the last 2 years, we've learned a lot in terms of some of the challenges and opportunities with respect to data. And I know that you in your role at Roche really took a leadership role, I would say, in bringing data together for good, for the purposes of trying to address the impacts and effects of COVID, which who knew what they were going to be when, on March 13th or March 11th, when the pandemic was declared. Do you want to share some of your experiences over the last 2 years and, what you've learned from that?
Happy to. I think it's a little bit of, we know we're headed in the right direction crossed with happenstance. I think when the time was when COVID was announced and we realized that this wasn't something that was going to go away in a couple of weeks, we recognized that there was a need to dissolve silos in a way that we had never done before, where companies were coming together with public sector to really try to figure out how we could get solutions to healthcare providers and patients and all the organizations who are involved in providing ventilators or ICU beds to work better together. And so what we did is we brought together a number of academic and private stakeholders, included DNA Stack, as well as Self-Care Catalyst, NVIDIA, RGA, Think DataWorks, to aggregate data that was in the open environment so that some of the best and brightest scientists and industry players could come together and create solutions to help inform pandemic task forces. And so while it was something that turned out to be quite a beautiful initiative, it was something that was brought out and canalized by the pandemic, but it could really show you what can happen when you use data for good, and what data access can actually mean for a healthcare system, as well as being able to address immediate market needs. Within 4 to 8 weeks, we had over 100 different tools, insights, dashboards, AI solutions that were deployed to pandemic task forces all over the world to help with things like social distancing policies, reopening practices, and testing strategies. And so we created an AI center of excellence around this operating model and have deployed it in the areas of neuroscience, particularly in ALS, as well as in rare condition, so that we can bring the best and the brightest around valuable data sets to bring solutions to people faster. And, it's like people are always asking, what is the value of bringing this data to the world? And it's like, infinite amounts of return in terms of being able to inform really big decisions. And so, you know, I applaud Canada for taking a step forward in the right direction. And I think we can continue to be leaders and to propel momentum forward in this space.
Thanks so much, Fanny. And Mark, at DNA Stack, you've also deployed some technologies in unique and different ways to both address the challenges of the pandemic and beyond. So why don't you share with the group some of the things that you've done and some of the barriers that you've broken down over the course of the last couple of years?
Thanks, Karen. And I'll first off applaud Fanny and Lisa for your incredible work in the context of the pandemic. I think it's important to appreciate how much we've been able to accelerate outcomes. And I think there's no better indication of the potential, the infinite potential, as Fanny so well says, for what Canadians can do by better managing health data. Before the pandemic, we were focusing on creating standards and technologies for more rapidly sharing genomics and health data for human health, things like neuroscience and oncology. And 2 years ago, we found out about this little virus that we anticipated would mutate, and for which tracking how it mutates and evolves would be critical to Canada's response. So we were emboldened by the digital supercluster to put together a national consortium that was aligned on the importance that creating digital infrastructure would play in terms of empowering Canadian decision makers to better manage our country's response. 2 years later, we've launched Viral AI, which is the world's first federated network for genomic surveillance and infectious disease research. And we've partnered with Genome Canada as part of Canada's national genomic surveillance strategy to be a data distribution hub for all of Canada's viral genome sequences, as well as the province of Ontario to create a private provincial data bank with AI-powered discovery for how they could inform public decision-making based on the evolution of the virus. We're now actively working with international partners to export this technology to low and middle income countries like India and places in Africa, and also repurposing the technology for outside of infectious disease, looking at how federated data networks in specialty-specific areas like neuroscience, autism, oncology, and beyond can dramatically improve our capabilities in creating AI-powered discoveries. So lesson learned, data needs to be shared. In rare disease and infectious disease and cancer and autism, we need to share data. Number two, people want to share data. There is public willingness to participate. You know, individuals literally give blood and have informed consent to share data. In the Pan-Canadian Health Strategy Report, I think so well articulated the challenge with the privacy chill, and that is very often easier to not share data on the premise that it's less of a liability. And I think we need to create better incentives that encourage organizations and participants to more broadly and liberally share such important data. But I think we've learned that technologists and entrepreneurs like Fanny and Yusuf are ready to stand up to the challenge. And I think this is a wonderful opportunity and the perfect timing for this conversation. So thank you all.
That's great. As you said, Mark, people want access to their health data. They want to share data because they want to have better outcomes. They want the system to be better. They want people to, smart researchers to be able to do the research that may one day save their lives or the lives of their family or friends. And there's no shortage of, alignment with the goal and the vision. I think all of you have shared stories where, the technology exists. The technology exists to enable this to happen today. And there are other things that need to be done in order to unleash the power of that data and the power of the technologies. One of the things that often comes to mind, and it's very well articulated in the reports, is trust. And as you say, Mark, there's a risk averseness because people are afraid about how that data may be used. At the same time, they're willing to do their banking on the internet and do their taxes online. So we can debate whether health data or financial data is more scary to people to have that shared. But what are some of the other barriers or challenges or opportunities, I would say, to actually make this the technology be able to support this vision and this goal, potentially even faster than people can imagine. Any one of you jump in.
So I would say that it's a really good topic because it's one that we've been talking about, I think, consistently at Roche. It's that intersection between governance and policy and technology. And then people are talking about how can you build all of these trusted policies within the technology itself, so by design. So let's say we talk about transparency. How can we ensure that the technology that is being built is transparent? Are people going to share their models? Are people going to show how the data was able to provide the outputs or the specific insights in order for us to be able to understand where it came from in the first place? I think, back when there was this idea that you needed to black box things, you needed to put technology in this secret place so that you could protect, your commercial interests and stuff. And I think the overall sort of community is saying, no, that's not acceptable. We won't have that because we need to be able to see how everything was rationally put together so that we can be confident that the decisions we make with the outputs are rational and that are, understandable to all of us, and we can trust it. So I think there is this new intersection of what people will work with and what people will not work with. But we're slowly advancing as a community in that space.
Great.
And if perhaps,
yeah, go ahead.
sorry, Karen, finish your statement.
No, go ahead.
Yeah, and I guess if I were to build on what Fanny just mentioned, understanding that the healthcare and the life science space it does have a lot of regulations built to protect every single patient and every single individual within a community. There is an extension to that as well, which is companies as well have understood what it takes to protect patients' data and how to anonymize and how to make it so that there is transparency in all the work that we do in order to meet these regulations and in order to provide clinical benefit in a way that is very much built with the clinical outcome or the patient's condition in mind. And when you look at the efforts done by groups such as Fanny and Mark, you realize that a lot of this is built at such a scale and in an opportunistic way, which solely revolves around how can we improve our lives and the lives of people around us. And medtech has been one of the lacking spaces, or life sciences in general, one of the lacking spaces compared to the financial sector, the electronic sector, insurance, a lot of the different sectors overall, which again speaks to the massive opportunity. Again, the fact that something is lacking behind only ultimately means that there's so much ground to cover to leap forward, and so much more to gain.
Thank you. One of the other things that I hear often is ensuring the ethical use of that data. And Mark, I'm wondering, you do a lot of work on standards, international standards, and I wonder if you would share with the audience some of the considerations around ethics and how you've managed that as part of the initiatives that you've undertaken.
Yeah, it's a really great question. I think that's, when we're trying to champion more broad sharing of data, the data use is one of the biggest blockers to perceiving it as a potential liability. So the way that the community is looking to solve this problem, but it's really an opportunity, is to digitalize consent and data use conditions so that it's very objective in terms of what individuals and families have consented to the use of their data. And on the other side, we're in the process of implementing a digital identity called Passport, which is a digital identity that has ascribed to it visas, much like the real world use of visa. It's a credential that's been ascribed by a third party that can be validated to say, yes, this individual is a bona fide academic researcher and they do have a research purpose, and they have REB approval. So it becomes much less objective and more clear cut in terms of who can access the data and for what purposes. And through early pilots of that technology, it's looking like it streamlines access and is more objective and a better way to enforce ethical use of very sensitive data.
Thank you. I think that's a great segue. We have a question from Jose in the audience who's interested in blockchain-based innovations. And Mark, I don't want to make an assumption, but some of the things you talked about may be enabled by blockchain. And I know, Fanny, you're working on a project that is enabled through a blockchain health wallet. So maybe you can share some of that experience with the audience.
I'll share just a few words. We see the future of health being very similar to what's happening in other industries like finance. If you look at Web 3.0 and blockchain and decentralization, we see empowering the individual to become the custodian of their health data as the future. And it's really blurring the lines between what is health data and what is other data. If you look at wearables and mobility and socioeconomic status, right? Like these other complementary data sets that can be meshed together with your individualized health data. I think this all needs to live in an ecosystem that is decentralized at scale. There are some really great pioneers in the Canadian ecosystem. You might want to look at Molecular U and what Fanny's doing in this space, but there are people who are thinking and advancing the state of the art in this area.
Yeah, to echo Mark's comments, I think we are learning from other sectors, particularly in the finance district, just because it is a way that we can have an auditable trail for data elements. So if somebody is building a tool with these particular types of data elements, we have to ensure that it's high quality, it's credible, because if the data isn't of those, particular quality, then the tool itself and the outputs can't necessarily be trusted in the healthcare system. So we are looking at things like blockchain just to ensure that the quality of the outputs are equivalent. I think that there's a lot of things that we can learn across different sectors, and I like the point about what is health data, because traditionally we've looked at health data as being the types of data that we provide our healthcare providers in their offices or in hospitals, but a lot of us spend most of our lives outside of these places, and the way that we behave in the consumer market, or even exercising, or what we eat, or how we sleep, really determines our overall fitness and our healthcare. So maybe health data is no longer this small little niche, but maybe health data is all types of data.
Mm-hmm. We all know the social determinants of health go well beyond what the four walls of a hospital or the four walls of a clinic. It reminds me, one of my favorite sayings, and it's been around for a long time now, is nothing about me without me. And we know that Canadians want to have access and control over their data and how to share their data. Certainly, if I was all of a sudden unconscious on the floor someday, I'd want those paramedics and those healthcare providers to have access to anything they needed to know about me to take good care of me. So, Yusuf, do you have any experience in terms of, patient feedback and the kinds of things that patients and clinicians are really looking to leverage from, the mountains and mountains of data that's available to them.
Yeah, so I mean, I'll speak within our own domain. It's actually very, very interesting. Patients, from a patient's perspective, what they're looking to understand primarily is understanding how to interpret the different data or the different clinical profiles that's happening in the hospital. If you ask a doctor or a surgeon, what's the number one question that they get, during the post-operative recovery period, which is our domain, you'll find that, am I doing well? Is everything okay? Is this pain normal? Patients are looking to understand, and if you look at the profession of a healthcare provider, a large portion of it is how to understand this information and relay it back to the patient in a way that makes sense and in a way that's understandable. While if you were to take a look at healthcare providers, I mean, their number one goal is to provide the best care possible. And no matter which hospital you look at, no matter what size, no matter what their domain is, everyone is trying to provide the best care possible for patients. And if there was a magic pill that they could throw at every single patient that guarantees them, perfect health every single time, they would just be throwing it around. So they're looking to leverage the data in a way that just enables that better care, and of course the economic benefit as well that comes with providing better care for patients.
So I know we're almost at time. We've got 2 minutes left. Time flies. We could talk for hours about this, I'm sure. But in the last 2 minutes, Fanny or Mark, do you have anything you want to make sure that the audience hears from you before we sign off?
I think the one message that we all are aligned on is that we believe in data for good, for AI for good, and open innovation. And we will continue to move forward with our communities in this very transparent, open way to show that we can do better together.
Thanks so much.
I love that, Fanny. And I think we absolutely share a vision. I think it would be really great to write it down. And I think that's what the important work of the Pan-Canadian Health Data Strategy has in front of them, is formulating, the Paris Agreement, but for health data. What is our North Star? Where do we want to be in 5 years? And how do we reverse engineer our tactics to get there?
That's fantastic. Again, I commend the expert panel and look forward to the next report. You can call on any of us, I'm sure, at any time, and we'd be eager to help actually bring this to life. Hopefully in my lifetime, fingers crossed. So I think we're at time. But in the meantime, thank you so much for taking the time out of your day, Mark and Fanny and Yusuf. It's been enjoyable, and I hope to see you again soon.
Thank you for having us.
Thank you so much. It was a pleasure.
That was great. Take care.